Hey guys, we're going to do a quick run through of my IV kit. No, it's not a 4 kit. It's the intravenous solution kit. Something I have for natural or man-made disasters to be used for my family or the people in my community. We're just going to do a quick run through what I have in here. Directly on the front, obviously it's marked IV kit, first aid, so you don't grab the wrong bag or the wrong kit. Top, you have a pen light. Right, light's important. Medical shears. You need to cut somebody's clothing off. Belt. Another headlamp here. All right. It's a lot easier to put this on top of your head, wear it, than just hold a light if you need to, treat a patient. Inside here, I have a multi-tool. Right? You can always use a multi-tool. Anything you can do redundancy on, do it. And multi-tool is one of them. Multi-tools, knives, lights, lighters, whatever you can double up on. And on this peg, I have different size catheters. Right? More size here. A couple of the old baby wipes, clean off. You need to clean your hands off or clean around where you're going to take care of the patient. Some non-stick pads, gauze pads. All right, you don't want to stick to some wound, cause the patient irritation. And there's another package of 4x4, 12-ply, just regular everyday gauze pads. Gauze pads they're cheap, and you need to have a whole lot of them. These are Tegrodam film. They're clear. It's what you would cover over the like if you did the catheter right here, you could cover it over. It keeps the wound clean, and you could still visibly see through it, just like you would see at the doctor, the hospital, right? So they can see, make sure you're in the vein. There's no issues. There's nothing leaking. Front here. This little kit here. I have a small little bag of clamps. Clamps, scissors, right? Different sizes. If you're going to need that for any other reasons. This one here. It's going to be for, it's like a spray, antibacterial spray, right? Hand sanitizer. Providone iodine for disinfecting and cleaning wounds or cleaning around the area where you're going to inject the catheter. Some more hand sanitizer. Like I said, redundancy, right? Here's a lighter. It's got a rubber band around it. Won't allow the plunger to go down. So I got a lighter, I got a rubber band, and I even threw around some duct tape on here, right? Front here. I have a little package here for full of iodine, sterile alcohol pads, or sterile alcohol prep pads. I have some triple antibiotic ointment pads. I got a little package of that. This is small little packets of Providone iodine ointment, right? You can put over any wound or wherever you just cleaned. Then I have some Providone prep pads, right? So it's more to keep everything sterile, keep the hygiene for the patient acceptable. This lower bag. Lower bag here, I have some Providone iodine pads. It's like a sponge, and it's full of that Providone. Use that to scrub, clean up around where you're gonna give them the IV. You know, you want them to be sterile, you want them to be clean, you don't want any germs, you don't want to have any infections. You get all that bacteria out of there. This is just a little package of small little square, what are they, 2x2 gauze pads. You can use those to, you know, to put over the catheter. Gauze pads, just as many as you can get. They're cheap. Here's some gauze rolls, right? This is 4 yards, 4 inches wide. Right here in that little roll, right? And I got a whole bag of them. Cotton balls, right? You know, you always see the doctor with cotton balls whenever you get a shot or an IV. So I got here on this side, I have sterile scalpels, right? They're disposable. Got some in here. And along with those, I have some sterile disposable syringes, right? Comes with the needle. Here's some more syringes. These are used for irrigating a wound. You use these to flush, right? You can just draw, pull on your saline, wash out a wound or an infected or you know, the gash somebody has and get the debris out. Top. This front pack. I have a assortment of rubber gloves, right? You're going to need that to stay sterile for yourself or your patient. Assortment of different tape. I have clear tape, cloth tape, like you'd use tape for a athletic wound, you know. One more Providone iodine pad, sponge. A package of North American saline lock kits, right? I have multiple IV starter kits. Here's in the back comes the tape. Get your start your IV. And I have a set here of the IV administration set. Right. There's multiple in here. There's probably I think 4 or 5 in each package. Roll of duct tape, right? Redundancy. Add room, put it in there. Now we're here on this one, in the back. I have a bottle of 0.9 sodium chloride irrigation. You should use those syringes, right? And irrigate and wash out a wound, or maybe someone has something in their eye, or an open wound. You know, you got a bunch of debris, trash, dirt, grass, whatever. You can use that to clean it up. Here I have IV administration sets, right? So you're gonna set your dosage up. Some more gauze, right? Some more gauze pads, 2x2s. Another pack of IV starter set. And the meat and potatoes back here, right? There's some more gloves, more rubber gloves, surgical gloves. Green, OD green. Got lactated ringers. Another bag of lactated ringers. One more bag of that. Another one. 5% dextrose. 5% dextrose. So you can see that here. So you can the ringers. Right. And I have multiple bags in here of about 6 of the 0.9% sodium chloride. See that? I have plenty of those. And in the back here, I have 2 packs of another 5% dextrose, different dosage. And then finally, I have pads, right? So you can have pads if you need to lay their arm down, leg, hands, whatever. You know, you got a clean, sterile place to get them off the dirt. Keep everything as clean and dirt-free as possible. Hygiene is going to be a huge part. You don't want anybody to get infected. Guys, that is my IV kit that I have, right? And just as for a disclaimer, everything I purchased here, I purchased over the counter, right? I bought it legally on eBay, Amazon. There's Mountainside Medical. I bought some stuff from. You can find some of this stuff at your local medical supply stores here in your towns, right? It's everything here was legitimately bought. So hope this gave you an idea of what you could put into an IV kit to add to your medical supplies. And as always, be prepared and be the solution. Carry on.